Yes. Had to get my workout in today, folks. Hey, I'm Scott Gibbons with Southeast Health. Thanks for doing the 2021 American Heart Walk. Thanks to Southeast Health for being the presenting sponsor of this year. So I know it's virtual, but we're trying to incorporate some things to make it exciting for you. And we're going to do some CPR demonstrations today, AED demonstrations, and also going to talk a little bit about when you need to help somebody if you're in a heart attack position like this. When we do CPR, which is cardiopulmonary resuscitation, it is on someone who is unresponsive and is not breathing, no signs of circulation. But before that, someone may be having a heart attack, which is just the signs or symptoms. This person will be conscious. They're going to be having persistent chest pain, radiating down the arms and to the neck, shortness of breath, nausea, sweating. Just in overall, that person doesn't look good anymore. They don't feel right. We need to recognize that, get them to help. So what do we do when someone's down? What's our first step? We come to them and we say, hey, are you okay? And we toss them around. No response, call that one number, and then we start doing compression. I got you there. I'm just kidding. Don't do that at home, boys and girls or parents. That is not what we do. But if someone is in need, we do need to help them. And our first thing is, hey, we recognize someone is unresponsive. We come up and gently tap and shout, or if you know their name, hey, you. If you get no response, your next step has to be to get help. Pull out your cell phone, dial 911, put it on speaker, go yell at someone. It's okay to leave that person and run to the house or run to a neighbor, but we want to get help coming right away. And then we come back and realize, hey, this person is not breathing, speaking, or moving. Nothing's going on, no signs of circulation. Begin hands-only CPR. Palm of your hand in the center of their chest. You'll be kneeling next to that person, arms straight, and you can use your whole body, and you will start compressing hard and fast until, if you get tired, then you can just stop for a second and rest, but hopefully if another person comes, they can take over. All right, AED use. There are different varieties out there. Schools, churches have them, but for the most part, they're going to be like this, or they're going to be like this green Zoll AED, which in our area and around the country is a very popular model. This also is an AED that Southeast Health Foundation does do fundraisers to help donate these to locations that need them, maybe schools, nonprofits, rural areas who are further from 911. So check out that site if you'd like to really apply for one. But on this one, these Zolls are very bright and green. I said most AEDs will be attached to a wall with the AED sign. If you're somewhere that has one, you'll grab it, bring it to your person. This particular one, you lift the top. Now this can be set aside, or it can be set underneath the neck to help open the airway if you chose to breathe on someone. But for our hands only and the AED, remember we have to remove the shirt or open it to display the skin because the pads have to be there. Now, on this particular models, the AED pads for adults will already be plugged in. AEDs can be used on adults and children. There is a separate pair of pads for children. Most of the time they go on the front and the back of the person who needs a shock. And this particular one is very handy because the pads are all connected. So if you can see the pads here, that's how they would look. The red plus sign I would lay in the center of the sternum and then just fold everything open and the pads fall right into place where they go. I would need to peel off the backing so that I get a good stickiness to the person's chest. And then let's fire on the AED. We will turn it on.
Unit, okay.
And it will follow the pictures and prompt me through everything.
Call for help.
Remember, as it's analyzing, don't touch the victim because you'll pick up the victim's pulse rate or it could pick up yours.
Don't touch patient. Press flashing shock.
You do have to press the button, so it needs shock. I press it.
Shock delivered.
Make sure nobody's touching it when I press. And then this one will have a rhythm. So as I go back to compressions, I can keep up with the beat, or I can sing Staying Alive if I feel like it. And I continue this. In a couple minutes, the AED will come back on and ask me to prompt that. That's how you use an AED. Very easy to use. Remember, compressions are great. It circulates the blood and oxygen, but the AED will actually restart someone's heart if it finds a rhythm and it needs help. So if both combined together, you have a better chance of survival for this person. All right, guys, I hope you enjoyed the AED demonstrations and the hands-only CPR. Hopefully it comes into use for you. Again, a big thanks to my twin brother, Will, here for being a helper today. He does a great job. A little quiet. I know I look much better than he does, but he's family, just like you guys in the Southeast Health family here. So a big thanks for that. Big thanks for Southeast Health for being the presenting sponsor of 2021 American Heart Walk. Thank you guys for your teams, your fundraisers, everything you did to do this. Get out and enjoy it. Thank you for raising money, and hopefully you get to save a life someday.